Hi, my name's Erin. I'm a staff nurse on a neonatal intensive care unit. I've been qualified now for 2.5 years. The process for qualifying to be a staff nurse is I went to sixth form and did my A-levels and then went on to university and studied a degree in children's nursing. You can do adult, mental health or learning disability nursing, so they're all specific to what you're interested in. What inspired me to do children's nursing and then eventually neonatal nursing is that I have always had a passion for caring for people. I've always loved children, loved babies, so I did my children's nursing degree, and then within that I did a placement on a neonatal unit, which I loved, so that's what led me to where I am now. You can progress as a staff nurse in many ways, not just in neonatal nursing, in any type of nursing. You start off as band 5, so that's just your staff nurse. You can do your mentorship as a band 5, so you can mentor other student nurses. After a few years experience you can be band 6, so that's more leadership and management roles. And then if you want to progress further you can be band 7, band 8, and you know they're more and more leadership and management. You could be a matron. So there are many different ways to progress. My shift patterns, I do long days and night shifts. My long days are 7:30 in the morning till 8:30 in the evening, and then my night shifts are 8 in the evening till 8 in the morning. I do 3 of them a week, and then on the 4th week or at least once a month I do 4 shifts a week to make up my hours. You can also do earlies and lates. Take us through a standard day in your role. I wouldn't say there is a standard day. I'd say every day is different, and you're going to get that in most nursing. For me, a lot of the things we do include feeding babies, not just bottle or helping breastfeed. We do feeds through a tube that go in the nose to the stomach, because a lot of the time we get really poorly babies or premature babies who can't feed themselves. And we do a lot of medications, so we do IV meds, IV antibiotics, oral medications, blood samples, infusions, fluids, blood transfusions, admissions, discharges, transfers in and out. And because my unit's also surgical, we have a lot of babies that go to surgery and then need post-op care. And that's just to name a few. A lot of our babies are on breathing support, so you know we need to know how to look after a baby on the ventilator. What is the environment like? So it's very busy and very fast paced. A lot of time it's just one job after the other, and it's very much you running off adrenaline. You know, we have to make sure we do observations, which on my unit are hourly, and make sure babies getting fed on time and having their antibiotics on time. What team do I work with? So we work with a massive range of people from all over the hospital. We work with the neonatal doctors who are on the unit 24/7, who are the first port of call when a baby gets poorly, or we just need help and advice on what to do, and they do ward round and set us up for the day. We work with surgeons because it is a surgical unit, so a lot of our babies come under the care of the surgeons. Work with a physiotherapist, which helps a lot with kind of position of babies. We work with the dietitian, so sometimes our babies don't put on weight like they should, or they're not tolerating the milk, so they come and assess the baby. Work with a salt and language therapist, who if our baby is not feeding properly or you know not getting to grips with bottle feeding, they come up and assess the baby and help us out. Work with a pharmacist who helps if we are given a medication we've never given before, or make sure that we're given the correct doses and the correct medications. So we work with a massive team. It's a very holistic approach to care. Can you give a positive story about a service user you have worked with, and why was it such a positive experience? I looked after a baby who was a term baby, but he'd just come to our unit, just needed help with breathing, and then stayed a bit longer because he just needed help establishing breastfeed. So it was mum and dad's first baby. I was on 2 long days together, and this baby, when I came onto my first shift, was day 2 of life. So throughout that day I was just helping mum, giving her advice, giving her support on breastfeeding. And then my second long day, you know, the baby was a lot better, he was a lot more alert, so he was able to be discharged. So I was able to take this baby around to the postnatal ward where mum was still an inpatient. So that was such a positive experience. It was mum and dad's first baby, so obviously they were really worried about him at the start, but then to see them so happy and grateful that he was all better and back with them was really positive. How do you manage attachment to service users you are working with? Is this challenging, or do you find it becomes easier the more you work in the role? I would say it is definitely challenging, for me anyway. Some of these babies we have are there for 6-7 months at a time, so you're getting to know these babies as they grow up, from being small and premature to being a term healthy baby. We see these parents all the time, so we get to know these parents, we create relationships with them. So yeah, you do get attached and you do form relationships, and I think it is challenging, and I don't think it gets easier. I just think you find new ways of dealing with it. You just have to remember that your work life is separate to your home life. Working in your role, have you ever experienced any abuse from service users? On a neonatal unit, or probably as well in a children's unit, you do experience a lot of parents that are upset and are angry because it's their baby or their child, and parents are very involved in their children's care when they're in hospital. So a lot of time as nurses we have to tell them that, you know, the baby's getting a bit poorlier, or something's not gone quite as it should do. So a lot of time this can make parents upset, and which is completely understandable. It's their little baby at the end of the day. Their baby's in hospital. No mother or father ever expects from when they're pregnant to then their baby be in hospital. That's just something that no parent ever expects to happen. So it's such a high emotion place to be. So obviously it's so difficult for parents, and you just, a lot of the time parents are only taking their anger out on you because you're the first port of call, you're the only one there. So it's not because they're angry at you necessarily. So I think as a nurse you just kind of have to remember that you can look up to your higher members of staff to come and help you if the parents are getting aggressive, but I think you have to remember to stay calm yourself and just make sure that these parents know you're there to support them. How do you embed the British values within your job role? We get a lot of families that come from different types of backgrounds, so different beliefs and religions, values, all sorts of things. So it's really important that we keep that in mind. We work alongside them, make sure that they are aware of everything that's happening, that they're involved in all types of decisions, and also make sure that we are giving this baby everything it needs to enhance its health and well-being. You know, a lot of the time a lot of religions don't agree with certain things, so you just need to make sure you're working with these parents and respecting their values. Do you have training on Prevent, and how does this link to your role? I had training on Prevent in my first week of working. We had an induction week, and someone came in and did a presentation on Prevent, and they told us what signs to look for, and what to do if we notice something suspicious. I think this does link to all roles within hospital, not just mine, because we could be walking down the hospital, or we could get a visitor in visiting a patient, and something could not be quite right and they're acting a bit suspicious. So it's important that we know who to tell and who to go to for them to investigate further. What is the hardest situation you have ever had to deal with in your role? I've had to look after a really poorly baby who got poorly very quickly, and I had to go into the meeting with the consultant and the parents, where the consultant was unfortunately breaking the bad news that there was not much more we could do. Obviously for the parents it was so heartbreaking. You know, the whole world is just coming down, so it's important that you as a nurse kind of put your emotions aside and you are there for that those parents through such a difficult time. Make sure that, you know, you're giving them all the support and answering all the questions and never leaving them out of the loop. After that meeting, I remember I took myself out for a couple of minutes, just went to the toilet, had a little cry, and then just got back to work, because you're there to help to nurse this baby. You're there to help this baby, so you kind of have to just push your emotions and everything you're thinking aside. And what I also found quite difficult was that you know, we were doing everything we possibly could for this baby, giving him every medication, every treatment that we could give him to try and help him, but at the end of the day we knew that none of it was really going to help. It was always going to have the same outcome, which is kind of difficult for me to get my head around, that, you know, we're trying everything we can and it was never enough. So that was really difficult. In that situation you definitely have to look for your colleagues who have been through similar situations, and your friends and your family, because you need that support system yourself. What is the most rewarding situation you've ever been a part of in your role? I would say for me, I've not just had one rewarding situation that kind of sticks out. I've had a number of rewarding situations over the past 2 years, which for me kind of outweighed the difficult times. From giving a mum and her baby their first cuddles. A lot of our babies are premature and they can't come out of the incubator for cuddles for 4 or 5 weeks at a time, so giving a mum the first cuddle after 4 weeks of the baby being born is really special. It's really nice to see. Helping a mum or a dad change a baby's nappy for the first time. It sounds simple, but a lot of our babies can be about 600 grams. Kind of wires coming from everywhere and can be ventilated, so it's really quite daunting for a parent to change that nappy, but for you to help them and then see them grow in confidence in changing the nappy and knowing you've been a part of that, and that's really rewarding. Giving a baby its first bottle, or helping mum breastfeed, first bath, even just getting a baby out of the incubator into a cot, seeing a baby that you've looked after a lot get better and progress over time is just really rewarding. I would say there's no other feeling like it, really. And discharging a baby, that's one of the most special things, that when a baby's been on the unit for a while, and you've seen them go from really poorly to better, and then you get to see them go home, that's really rewarding. So nursing definitely has its hard times, but a lot of the rewarding times definitely outweigh the difficult times. Thank you.